Hi, everyone. This is Andrea. I just wanted to go through a few questions from the exam today that seem to have the overall lower statistics. If you want to set up a private Zoom or phone call with me, I'd be more than happy to go over your exam. So some of you have already reached out, and I encourage you to do that. The first question I want to go over talked about a client that came to the emergency room after a motor vehicle accident. This client had bilateral rib fractures and lab results indicating illegal opioid use. So if we think about this client, they would not be having good respiratory full deep breaths, and they're probably not going to be able to get all the carbon dioxide out of their lungs when they're breathing. So this client is going to be in respiratory acidosis. The reason it's respiratory is this just happened. They just got in a motor vehicle accident. If this doesn't get corrected in 24 to 48 hours, that respiratory acidosis could turn into metabolic acidosis. Okay, so in those illegal opioid use, it would be a sedative, so it puts client at greater risk as well for developing respiratory acidosis. The next question that I want to go over, a nurse suspects a client's in fluid volume excess. What are we going to notice in our assessment? So we are not going to notice thirst because our clients get thirsty when they're dehydrated. We will notice things like bounding pulses. We're going to notice some peripheral edema and potentially those distended neck veins as well, are all things that we might see. Um, we're caring as nurses for a client in hypovolemic shock. Some of our priority actions for somebody that's in hypovolemic shock. So remember, with hypovolemic shock, they don't have enough volume. Their blood pressure is going to be low. They need supplemental fluid volume. So they're going to need IV fluids, either lactated ringers or normal saline. And then they're also going to get medications to help increase their blood pressure. And dopamine is a common medication that can be given for that. We're not going to give them things like epinephrine, diphenhydramine when they're in hypovolemic shock, because we give those for anaphylactic shock. So really making sure you know the difference between the different types of shock that there are. Okay. And then the last one that I want to go over, nurses monitoring clients in cardiogenic shock and the clients receiving dopamine, some of the side effects. So we talked about this a little bit in the review, and I had asked you to look up dopamine. Clients with dopamine are going to get a really bad headache, and they also are going to have decreased intensity of their peripheral pulses because their blood's going to shunt to their core, and the peripheral pulses are not going to be as present as that medication is working to try to raise the blood pressure. So a couple areas just to talk about. Please reach out to me if you have questions. I'm more than happy. I'm here to help you. So I can pull up your exam, kind of see where your strong and weaker areas were, and we can talk about that. So email me, let me know what you need. Thanks.